Hello, this is Dr. David Bilstrom, and the question we're answering today is psoriasis an autoimmune disease? And what's the best treatment? An emphatic yes, psoriasis is an autoimmune disease, but many people that get diagnosed with it aren't told that. But this also goes back to why the typical topical creams that get used for psoriasis just don't seem to do the trick, because it is an autoimmune disease. And yes, anytime you see a skin issue like psoriasis, the first thing you should think of is what's going on with the gut, because there's such a tight connection between any skin issue and the gut. But of course, because psoriasis is an autoimmune disease, the first thing you should think of is what's going on with the gut as well, because the gut is the absolute central mechanism in not only chronic disease, but any autoimmune disease. So this is why if people are recommended to use creams for psoriasis, yeah, it may help a little bit, but it just doesn't seem to do the trick, because you're really just going after the symptom of the autoimmune disease, which is the psoriasis, the skin changes, without actually going after the cause. Okay. So this is where you may say, well, geez, I used this cream, it didn't work. Well, if we go after the cause and get the body in a position to actually heal and be in a position to actually fix things, then the things that you would tend to use topically are going to tend to work so much better. So, for example, we always know infections are part of every autoimmune disease. We actually know that infections are part of every chronic disease now, too, including you can get infections in the gut. So if you do your due diligence and address the autoimmune disease psoriasis as we would any autoimmune disease, including using the pH structured silver solution to clear any infection, no matter where it's at, gut included. But then also we want to treat the skin, of course, because that's where the autoimmune disease is showing up. That's your weak spot. Whenever you say, well, why did my immune system disruption cause the attacking of this body part? Well, that's because that body part is your weak spot. So in somebody with rheumatoid arthritis, the weak spot is their joints. Somebody with multiple sclerosis, the weak spot is their brain. In people with psoriasis, the weak spot happens to be your skin. So we have to heal the skin as well. So steroids don't tend to work. They just get rid of inflammation. You don't want to use antibiotic creams. They get absorbed in the body. And it's just like an oral antibiotic, basically, that disrupts the intestinal microbiome, throws the central mechanism off even worse. But you really don't want to use steroid creams too, especially because they talk about, if you have a skin issue that's fairly widespread, if you're putting steroids on your cream, it's getting absorbed in the system. It's basically like taking oral steroids, all the downsides that go with that, including risk of vertebral osteoporosis, fractures, and all this other kind of not nice stuff. And so what you want to do is you want to heal the skin, okay? Just because you get rid of some inflammation in the skin doesn't mean the skin cells are going to heal, especially because your skin cells, for some reason, are this weak spot in your system. So what we like to use is the pH structured silver liquid gel topically, because if there's an underlying infection there that's kind of making the skin a weak spot, such as maybe mold might be there, that kind of thing, it'll get rid of the infection. But interestingly enough, it will also get rid of inflammation and help damaged tissue heal. And this is what you want. You want to get rid of the inflammation that's driving you crazy and is very uncomfortable, but you want that damaged tissue to heal as well. Now, if you take care of the reason why you got an autoimmune disease, boy, is your skin going to be ready to heal once you help it heal. The original data on this aspect of the pH structured silver gel came from its use in people with burn injuries. So as you can imagine, people with widespread burn injuries, such a problem, right? We'll talk about damaged tissue, but there's a big problem as you're trying to get that tissue to heal of infections. And if you get an infection in the burn injury, that's just going to totally slow down the whole healing process. Big mess, all this kind of stuff. But what they saw was that not only did it keep away infections, which ideally put this tissue in a position to heal quicker, the tissue actually healed quicker than if you weren't using the silver in the first place. And they go, well, that's really interesting. It's not just keeping away infections, it's actually helping the damaged tissue heal. How does that work? So there's a fabulous study that was done on the epigenetics of skin cell healing. So now if you remember, it's not so much what genes we have in our cells. The genes tell the cells what to do, our DNA. It's which ones get turned on and turned off, right? And so you want to turn off all the bad genes and cells and turn on all the good genes so that tissue has a chance to heal. Well, there turns out to be 88 different genes in a skin cell that code for skin cell healing. When you use pH structured silver solution and gel, it upregulated the activity of 59 out of those 88 skin cells, genes that code for skin cell healing. Oh my gosh, you're turning on the genes that allow the skin cells to heal so much quicker. Now, 58 of those genes that were upregulated to work more extra to heal the tissue doubled their activity. One of them, which is a real common one to run in families and drive family skin issues, kind of goes back to why your skin cells might have been your weak spot, right? And when autoimmune disease hits you, it hits your weak spot, the skin. So one of the genes was actually upregulated 80 times normal, and that tends to be the one that actually runs in families and makes skin cell disease a family thing. Fabulous science on this. Great question. Yes, psoriasis is an autoimmune disease. Yes, you can get rid of it. Yes, you got to treat the whole big picture, but to treat the skin cells topically with something that actually fixes the epigenetics of why those skin cells are your weak spot and why you might not be able to heal them, profound.